These five drugs have been banned or have been completely discontinued in Europe and especially in the USA, but it's still very much in use in Nigeria. Nigeria. The first drug on our list is ranitidine. Ranitidine is a H2 histamine receptor antagonist. Forget. Calm down. The big English don't be plenty. What it means essentially is that ranitidine helps to reduce the amount of acidity of the stomach or the acid in the stomach, helping to balance out ulcer. But it has been withdrawn since the FDA, that's the Food and Drug Administration in the USA, has called for withdrawal since 2020 because of ranitidine's potential cancer-causing effect. The next drug on our list is domperidone. See as the name sounds really sharp. Domperidone is a drug that is supposed to be used in Nigeria for as a prescription-only medication, at least supposed. This drug is used for nausea and vomiting and other gastrointestinal motility problems. You sef get me. But this drug has been discredited by the FDA, which is the Food and Drug Administration in the US. Why? Because this drug has potential risk when it comes to the heart, right? Another drug we have on the list is phenacetin, as you say, phenacetin. Now, this drug is an old pain reliever, pain and fever relieving medicine, right? And it has also been banned in a lot of countries around the world. But in Nigeria, where we dey, this drug, for some reason, known to the people that are using it, is still being used as either over-the-counter medications or as a bulking agent to pure cocaine. Now, what do we mean by bulking agent? It means like they will add powder, make the thing come plenty. God bless you. Now, this drug has been banned by medical authorities in Nigeria, although it's still in use underground, right? And the reason why it was banned in Nigeria was because it causes kidney damage, in brackets, analgesic nephropathy. The drug, the disease name can't dey long, but it's not too much. It causes kidney damage, and that's the major reason why it has been banned. Also, there has been an incidence of our proactive and ever-ready NDLEA to go and curb this drug. Now, let me give you an example. Do you know that 75 kilograms of this phenacetin was intercepted because of what? It was hidden and what? Labeled as foodstuff. As okporoko. I don't know whether na okporoko abi na egusi. It was hidden and labeled as foodstuff during an anti-narcotic operation. That was why they intercepted it. This drug is not legal, right? So please, let's move on. Ambulance! Another drug on this our list is Furazolidone. You see as the name thick, abi? The name is thick. They look say, pharmacy no easy o. Many big name like this. But let's go back to what we are saying. Furazolidone. Bless me. Furazolidone has actually been banned in other countries, especially a lot of European countries. But it is used as an antibiotic and an antiprotozoal medication to treat intestinal infections. You get infection inside your GIT, your stomach, your belly, your stomach, small intestine. It has been used. Now, it faces strict regulatory limits in Nigeria, not necessarily like it's totally in over-the-counter use in Nigeria, but it is still in use. Now, it is majorly seen in combination therapy with some other drugs that helps to potentiate its effects. And these other drugs, like, they work as an anti-diarrhea, they help to reduce diarrhea, right? But one of the major reasons, right, one of the major reasons why it was banned is because it causes hemolytic anemia. There's a risk of causing hemolytic anemia, especially in infants, right? Infants or old patients. So if somebody is very old or if somebody is very young, there's risk of the person developing anemia. And we all know what anemia is, right? Shortage of blood. So please encourage me. Don't be looking at me as I'm facing camera and I'm doing all these things. Encourage me, subscribe, like this video, support. Thank you.